Many were weeping, many discouraged, many gave up hope on the dreams to parenthood because of the high cost of IVF. This is a story of hope. The foundation was set up to provide a support system to couples trying to achieve conception and has been involved in subsidizing and greatly discounting the cost of IVF treatments in the journey to parenthood of hundreds of couples. And today, many have received the abundance of joy and become joyful parents. 3 years ago, the Georgia Abebe Foundation embarked on an audacious project to reach 10,000 couples trying to achieve conception with IVF treatment in 5 years, called the Be Fruitful Project. After almost 3 years, the following are our good reports. Over 5,000 couples have had fertility consultation and counseling with our specialists. Over 1,000 couples have had IVF treatment. Over 450 babies have been born and over 400 have been confirmed pregnant, and many more still on their journey to parenthood. For these 100 confirmed pregnant, we say thank you, Lord. As we celebrate God in praises and thanksgiving for the amazing act of God in the last 3 years of the Be Fruitful project, we are confident that God is about to do more, as He has in turn turned many couples into joyful parents. For these 100 confirmed pregnant, we say thank you, Lord. For the hundreds of couples that will be confirmed pregnant this year, we say a big thank you, Lord. For the hundreds and thousands of babies that will be born to couples waiting for their bundle of joy, we say 1,000,000 times thank you, Lord.
All right, good afternoon, ladies and gentlemen. I'm very sorry that we are coming quite a bit behind schedule um, due to some technical issues and some other factors, but I'm glad that we're here. So you're once again welcome to this month's Fertility Forum, organized by Jojo Abebe Art Foundation together with the Jojo Abebe Fertility Center. And this month, we'll be looking at a very important topic, right? I don't think we have treated this topic before, but it's a topic that most, well, let me not say most, but the majority of patients who are trying to achieve conception will have to grapple with. And that is talking about donation egg donation IVF programs. So I decided that we were going to delve into that topic this month to give some knowledge about what the whole process of egg donation is. All right, and so we'll be taking that topic to understand the egg donation process in IVF. Let me start by saying that up to 60 to 70% of couples who are going through IVF to achieve conception would achieve that through a treatment option that will require the third party. When we say third party, we mean either you are using an egg donor, or you're using a sperm donor, or you are using a surrogate. And a surrogacy means that someone is providing the uterus that will carry the pregnancy, and you we would have to get the sperm or the egg from either the the intended parent, or we will use an egg donor from another source, or a sperm donor, as the case may be. But today we're going to be zeroing in on egg donation, the egg donation IVF protocol, and then provide some understanding as to what the process is and how it is done, particularly in our center. So, egg donation IVF involves using a donor egg, which is fertilized with the recipient's sperm. All right, it's the use of donated egg. What that means is that we are getting egg not from the patient herself, but from an egg donor. Now, this protocol is used when the recipient's eggs are not viable, either due to age or when there is, for whatever reasons, a very low ovarian reserve. When we say ovarian reserve, we mean the egg store in the ovary is significantly depleted. Usually, it is age that we usually would deplete the store of eggs. But however, there are some patients who have an early depletion of the egg store, in which case we're talking about premature ovarian failure, or what we call premature ovarian insufficiency. And this can be due to either a genetic factor, or it could be due to other acquired conditions like the use of radiation or chemotherapy, or if you had surgery and the ovaries had to be taken out. All right, in which case the egg store will be significantly depleted. Now, once we have such a situation, then the couple is advised to use an egg donor. But the overriding indication for the use of an egg donor is usually age. Why? Because a lot of the patients, by the time they are coming in for IVF, a lot of them are usually in their late 30s, in their 40s, and by the time you get to that point, the quality of the egg is significantly reduced. So even when you go through IVF once or twice, you will discover that you're unable to achieve good outcomes because of egg quality. Now, egg quality is directly related to the age of the patient. The older a woman becomes, the less the quality of eggs that she would have. And the cutoff age is usually 35 years. Below 35 years, the egg quality is good and there is a good chance of achieving a good outcome. Above 35 years, the quality of eggs begins to drop, and that therefore means that the chances of achieving a good outcome is significantly reduced. Once you get to the late 30s and into your early 40s and above, there is a significant reduction in the quality of eggs that will impact on the quality of embryos, that will definitely reduce the outcome. And so for such categories of patients, they end up having to rely on an egg donor. So what usually will happen is that the recipient will undergo an IVF with the donor's egg and our own uterine environment to achieve conception. What this means is that we will get eggs from a donor, we will get sperm from the recipient's spouse, we would fertilize the egg, culture and produce embryos, and the embryos would be transferred into the uterus of the recipient, either on day 3 or day 5. All right? So, talking about egg donor selection process, because for those who would want to go through this process, one of the things they probably wonder how it's done, it's how do you select an egg donor? First of all, from my practice, I've come to realize there's a lot of resistance. Once you bring up the idea of an egg donation. To be fair, I would say that now the acceptance has really grown, and a lot of people really do accept to use an egg donor, particularly when they know that that is the only viable option available. We do see a few couples who will still insist that they would want to try with their own eggs, particularly if they've not done IVF before. And they are hoping against hope that although the prognosis is poor, that their case will be different. All right. So once we have determined that it's an egg donation program that will be needed by the couple, what we do is that we go about ensuring that we provide suitable egg donors. All right. I want us to realize, for those who are watching, that we don't use stored eggs. All right. What we do is that we use fresh donors that produce fresh eggs that we use, that we inseminate. All right. And so for that, we therefore have a list of donors that we work with. We have agencies that we work with. We have an agent in house. All right. That will recruit suitable donors for us. Now, these are donors who are young, between the ages of 21, 22 to 25, 26, 27, 28. So that is the age bracket of donors that we use. They are usually high school graduates or those who have finished school, all right, and they've started working. And then what we do is to carefully screen these donors to ensure that there are no disease conditions. Okay, so they will go through some tests. First, we need to determine their blood group and their genotype. As a standard, we use AA genotype for all our patients, irrespective of what your genotype is. Even if you are AS, speaking of the donor with the patient, the blood group is very, very important. And then, so we need to determine what the blood group is. The other tests we do would include hepatitis B and C, syphilis, and HIV tests. These tests are all done routinely and for all of our patients. And once they have cleared that, and then they've gone through the detailed physical examination and evaluation, looking at their family histories, and then they've all cleared the criteria, then we can now go ahead to schedule them for the program. We also will counsel them to ensure that psychologically they are prepared to go through the process. And thereafter, all the necessary documents will want to come up. And so they sign up they give the consent, because every donor that we use must give an informed consent, and they must be told what exactly they want to do before they start the process. And so once all of those things are done, then we can go ahead. Before I go on, let me also state that part of the things that we consider when we are selecting donors and we are doing our matching is we'll also look at the color and the height. Those are essentially the things that we look at. Why? Because we are also mindful of the fact that we want to be able to match the donor with the color of the attending couple. All right, because if a couple, for example, both of them are fair, we will not get a donor that is dark. All right, we want to get a donor that is fair. So we use their colors to be able to match, and of course, the height of the patient. All right, so we get all of these things done, and then we go ahead. Let me state here that we don't do any genetic test. Oh, patient will say, oh, how do you know they don't have any genetic abnormality? Do you do any genetic test? No, 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 we don't do any genetic test, okay? What we do is that we take a detailed history, find out about their family histories, or if there are any inherited or familiar diseases, okay? Yes, while I agree that that may not be very exhaustive, we have discovered that from our own practice, it's not practically possible for you to begin to do genetic testing for all donors before you use them and collect eggs from them. All right. So once we have selected our donors and we have done a scan and they meet all of our criteria and all the necessary blood tests and other evaluations have been done, and then they've signed the consent form, the donor would start off stimulation. The donor, once the donor sees her period, she's going to be stimulated to produce eggs. At the time the donor is being stimulated, that is also the time that the patient's endometrium is being prepared. The patient's endometrium is being prepared so that by the time the donor has been stimulated and it is time for us to retrieve the eggs, at that same time, the patient also would have been ready. And so, what usually would happen is that while we are preparing the donor, giving her injections to stimulate the ovaries to produce eggs, the patient is going through her program of ensuring that the endometrium is made ready. So she will take injections to down-regulate her, and after she sees her period, having done her mock embryo transfer, she will commence estradiol to build up her endometrium. And every week she will come for a scan to ensure that the endometrium is responding well. All right. So once we are getting close and we already have determined the day that the eggs will be collected from the donor, the patient is told so that the husband is available. The husband will produce sperm, and then we would do the insemination. Now, insemination can either be through the conventional IVF or ICSI. Now, if it's ICSI, the patient most times would have been informed that she is going to have ICSI done. And ICSI means intracytoplasmic sperm injection, and that is usually done for couples that have male infertility, that the sperm parameters are not optimal, that you have very low sperm count or very low motility, in which case to achieve fertilization, you will need to have ICSI done, where the sperm is picked up and injected directly into the eggs, and thereafter the culturing would take place. I want to state here to give some clarification concerning what ICSI does, because a couple of our patients have said, "Oh, doctor, I'm doing ICSI, so there should be no problem with sperm, so everything should be fine." I said, "Well, it's not exactly so. All right, when you are doing ICSI, what we are trying to do is to achieve a greater percentage of fertilization, a greater success rate in terms of fertilization. But in terms of the outcome of that fertilized egg going through the culturing process, being able to produce a very good quality embryo is a function of the quality of the egg and sperm. Therefore, if in this case, if we are doing an egg donation program for which we assume that because we are using younger ladies and the egg quality will be there's if the sperm quality is poor, you are still required to build up and improve the quality of the sperm. And what do? We offer you, we ask you to take supplements for some months, and that the hope is that we're able to improve the quality of the sperm, so that in spite of the fact that you're doing ICSI, we want to ensure that we achieve better outcome in terms of the quality of the embryo that will be generated. All right, so I needed to just make that clarification. So usually we allow the embryos to culture for 3 to 5 days, and after which an embryo transfer will be done. Typically at the Abebe fertility, we usually do day 5 transfers. Most of our transfers are usually day 5 transfers, where we will transfer a blastocyst. All right, why do we do this? We do this because it offers us the opportunity to be able to select the best embryo for transfer, and we've gotten amazing results. So the 5 of transfer will hopefully will have generated very good quality embryos. All right, and then the patient is will come in on that day, and with the use of a transfer catheter, the on under embryos, not more than that. And we usually expect the endometrial thickness to be at least 7 mm. So that will mean usually between 7 to 14 mm thickness of the endometrium. Once we are able to achieve that, the patient would have the support, the use of progesterone. Initially, on the day of insemination, or after the day of insemination, when fertilization has been confirmed, the patient usually will start on injectables, on gestone, and then once we have done the transfer, and we change, and then the patient is now on the vaginal insert. She takes that on for 2 weeks until the pregnancy test is done. And once the patient has been confirmed pregnant, the luteal support will continue with the use of the vaginal pastry. And then we'll also now introduce the progesterone injections. All right. I want to say the reason why we usually do suggest to patients the option of the third party, because it improves and increases your chance of success. So typically, success rate in an egg donation IVF program is higher than the traditional IVF due to the fact that you are using a younger, healthier egg in the patient than you would otherwise have done. So imagine you have a patient who is 40, who is 39, 41, 42. Compare the quality of that egg to someone who is 22, 23, 24. All right, the one who is younger obviously definitely have a higher quality in terms of the eggs, and that would translate to better embryo quality and better outcome. And that is why it's no wonder that the success rate from an egg donation program is usually between 50 and 70%. All right, and this again would also depend on the uterine health, the health of the endometrium, and other non-ovarian factor. Now, because you are using a donor egg, you most times we do achieve great results in terms of embryo quality, but sometimes we don't. Why? Because we still have the sperm quality to contend with. And then I must also say too that although we say that, oh, young, because they are younger, they should produce better quality eggs, but I've come to realize that the quality is not the same across board. There are some donors who are super, who have very, very good quality eggs, and there are some other donors too that have average quality of eggs. All right. For example, a donor that is polycystic, all right, that have what we call polycystic ovary, when that donor is stimulated, the quality of our embryo will not be as good as a donor that is non-polycystic. All right. And so I needed us to also clarify this, why we hope to ensure we get the best quality eggs from a donor. Sometimes the quality do varies. Okay, above the normal levels, the qualities do varies, and again that will impact on the on the quality of the embryos, and then